Well, give us an intro. Who are we talking to?
Well, today we have, right now I should say, we have Eric Freeman, Dr. Freeman. He's with Southwest Spine and Pain. And I forget, are you anesthesia-based or
I am.
PM&R? Okay.
Yep, anesthesia-based.
Anesthesia-based, and you've been in practice for how long?
Let's see, now it's 12 years.
12 years. And you
12 years.
have participated or came to the conference since the beginning.
Yeah, since the very beginning. I remember the very first conference we planned, we came up here, and it was a much smaller group. But I have to say that, I mean, the thing that I love about it is it's a lot of just camaraderie. You know, you see people whose names are on notes and faxes and everything else that we get and share amongst each other, and it's like, oh, I never see those people.
Put a face to the name.
And here I finally get to see them and interact with them. It's great.
Amazing.
I love it.
It's amazing.
And sometimes a few surprise.
Oh, yeah.
I've seen the name. I did not expect that.
That did not match. That doesn't match at all.
I wonder how many people say that about
I
me.
know,
Oh,
right?
my gosh.
I know, right?
That's wild. Well, we just
funny.
got done with the second session for the start of the 2025 conference, and I think mostly what we've been trying to capture is just some takeaways. What highlights, what's resonated with you, and the people that have spoke up to this point in time.
This last session, each speaker had something unique, I think, that they brought into it. And of course, I'm pain management, so Holden Brown, and I know Holden, such a good guy. The mustache it just fits.
It was,
I'm surprised he could have worked that in somehow to his talk, relate some spine condition to a mustache.
He should have, and it helps him because he looks at least 18 years old.
Oh, Alex,
it is true. He has the baby
there.
face.
He
He's got the baby face. But I loved how he approached it very differently than we typically do in spine management, which is we are reactionary. Someone has a problem, we do something about it. And a lot of times we leave that proactive approach to the chiropractors and the physical therapists, and we just take care of it when it's a problem. And I love his approach of being proactive with all the patients that he sees and treating them individually. The not very active, kind of overweight trucker versus the very active, young, healthy woman who's his wife. And I think that's really where medicine needs to go. I hope we can get there.
I love that. Medicine 3.0. I think that was a strong point.
Yeah, I agree. And I feel like you guys have been great at that, and we've worked well with your clinic and always had good feedback from patients that we send that way, because I know if I send them down to see Dr. Freeman or any of the colleagues at Southwest Spine, they're just going to get good care.
Absolutely.
Well, it's always funny too, whenever, if Dr. Holzer, myself, any of you, to anyone, if you go through your own little medical issue, all of a sudden you get a lot more compassionate for people.
Yeah.
And you realize, what do I need to do for myself? I need to exercise. I need to build up my core strength. I need to be more active. And all of a sudden you find yourself talking to your patients, hey, you know what? You need to let's build up your core strength. Why don't we get a little more activity in your life? And I think the way that life approaches us and attacks us helps us be hopefully better providers for other people as well.
Absolutely. I think I've mentioned this before, but are we buyers of what we're selling, right? And I think it's so important for us not only to be educating our patients, but also taking that advice that we're giving to our patients and implementing it in our daily lives from our own health perspective. And I do think that having these experiences or having setbacks or injuries, it does help us connect with our community of patients because we can understand and appreciate what they're going through.
When it's interesting as providers, when we face our own issues, all of a sudden we're reaching out to our physical therapist friends we know in the community. We're reaching out to our surgeon friends, our chiropractor friends, and it really builds that sense of like there's no way that any one specialty can really take care of all the healthcare needs of our community. It takes an entire team, and that's one of the reasons I love this conference, because it builds that sense of teamwork and camaraderie that we're not afraid to call each other like, I don't know what to do about this.
Absolutely.
And they're right there to help you.
Yeah, the one, and to speak to that, what stood out to me was discussing the medical billing.
Yeah.
The modifiers that he's talking about and the descriptions that you need and the numbers and values that correlate with all of that. I don't know how any one medical provider could ever be expected to know and understand and be an expert in all of that. There's no way.
It'd be impossible.
It would be impossible. But realistically, the world that we live in, there has to be reimbursement to keep the system running. And you can't do your job if you can't keep the lights on in the building.
Absolutely.
Right? So again, just another team member that we need involved in helping us all be successful.
Absolutely. And those are the people that are never seen. They often never see a patient. and yet they're so critical in being able to take care of those patients and keep us able to continue providing that care.
Yeah.
That fit in with me as well too when looking at removing the pituitary tumor. That yes. She was so gracious to Dr. Edwards and like, well, he does all the exciting part, but the reality is he could never do his part if she weren't there.
Of course.
And she did all, opens the tissues and gets him to where he needs to be, just like a anterior fusion in the lumbar spine. The general surgeon is going to do the same thing. You can't do it without the other team member.
Yeah,
absolutely.
Yeah, tell us a little bit about your team. Who are you guys working with, or what's the interaction like in your office?
You may see some of it tomorrow as Dr. Holzer and I present.
That's right. We get a little preview today.
We try to really create a sense of joy in what we do, and this is something that Dr. Holzer and I really embrace. That our goal is to try and help everyone. The reality of medicine and of life is that there are going to be people that we are not able to help, that are stuck in where they're at, and no matter what we do, we just can't get them past that. But it's a privilege to be able to try. That the privilege of medicine is that we can try to help everyone that walks through that door. And that's the kind of the spirit that we try to set up in our clinic, of every patient we see, every time we interact with each other, whether it be an MA or a front desk person or a provider, we have that privilege to try and help. And we have a fun time doing it. There's a lot of joking, there's a lot of being able to spend time with each other. I think the reality is, unfortunately, I spend more time with the people I work with than I do with my own family.
Yeah.
And so we really want it to be an enjoyable experience. And so that's what we do. Our MAs are, I feel, and I'm sure everyone in this room would say the same thing, I think they're the best MAs in the world.
Yeah.
And most of them are college students. They're working towards something different, to either go to medical school or PA school or become nurses or whatever it is. But their intent is amazing. And that goes for our front desk staff, our management team, everyone.
I think that speaks volumes to the top-down approach. I think when you're, as a leader, just that mindset of embracing the team and realizing everyone's value, I think it's so influential amongst the whole party, right? Everyone wins, right? And I think taking time to get to know your front staff and being there for them, it makes a difference in the end. And I have personally had the privilege of having one of your former employees shadow me for his PA clinical rotation, and just nothing but good things were said about Southwest Spine and Pain and how it's ran and like the function of it. And I think all of our referrals and patients that we have sent to you, I mean, obviously we've gotten nothing but positive feedback. So the reason why we keep sending them to you is because you do such a good job. Hopefully we're not overwhelming you.
Oh, hey, you know what? We'll make room.
Yeah, I love that.
But the feeling's mutual on that, for sure.
I love that. And I think one thing that you highlighted was something that Josh Pinson brought up, is like aligning expectations. And I think too few times do we take time to educate patients and really go over the like risk stratification and the expected outcomes and what our limitations are as providers. And then I think with that, I think encompassing the group, like reaching out to Dr. Freeman or pain management and saying, hey, look, I could use some help. What do you think about this? I think it's so important for our community.
I loved what he talked about, expectations. That is one of the things that's so important to me. I tell my kids, I tell my MAs that, and it's probably, it seems pessimistic, but the secret to happiness in life is low expectations. And
set the bar low.
And I tell them, though, now you can't get pessimistic.
Is that how you got married?
That's exactly. Yeah. You got to set those low expectations, so that otherwise they're going to be unhappy for the rest of their life.
It's true. It's true.
It's so true. And my wife would 100% agree with that one.
Yeah.
But I think the key is being able to both talk with patients realistically. And like he was mentioning, it's not a matter of talking down to people. It's not a matter of being insensitive. It's just being honest with them and telling them you're in a really tough situation.
Level of vulnerability.
And I'm going to do everything I can to help you. But the reality is, probably at the end of the day, you're not going to walk out of here 100% better. But my hope is we can maybe get at least 50 or 60% better, and maybe that's the difference between sitting on the couch and getting out and going on a hike. And that's where we want to get to.
Absolutely.
So I loved it. I loved what he was talking about that. We preach that regularly.
Myself.
Well, Dr. Freeman, we'll let you get out of here. We're excited to hear from you up on stage tomorrow. Can't wait for the next analogy.
All right.
I love it. Thanks, Dr. Freeman.
You bet. Thank you.
Are you ready for this?